Hello dear medical students, welcome back to a new video, and in this video we are about to start a new series on medical conditions. ठीक है, in this series, in each and every video we'll be discussing about some particular topic or disease, like very common diseases. Suppose if we talk about fever, right, we'll be discussing about what are the symptoms of fever, what are the diagnostic tests we can do based on the symptoms, could be the possible diagnosis, and what could be the treatment like available for the patient to treat his condition, right? So these videos will be a simple overview of any medical aspects, and I hope this will be uplifting our knowledge and will be doing for our betterment in our medical line. Okay, so let's start with our first topic, that is a very general and very common topic, that is fever, right? But with a twist, we are having fever with burning micturition. First of all, what is micturition? Micturition means urinating. Okay, urinating, that is micturition. Burning micturition means when you are urinating you are having a burning sensation. Okay, and this happens because there is more acidic nature in your urine, and so you are having burning और जलन जैसा फील होता है आपके यूरिनेटिंग के टाइम पे. तो हम सब डिस्कस करेंगे इस वीडियो में. एंड बर्निंग मिक्चुरेशन को एक टर्म में बोला जाता है क्या? डिसयूरिया. ओके, राइट. Suppose if we talk about a patient who came to us with this chief complaints, this was where fever. So fever means he is having body high temperature, right? Next, lower abdominal pain he had, that is pain in the lower part of his stomach. Next, dysuria, as I said, a burning sensation while urinating, and hematuria, that is blood in the urine, right? After seeing the symptoms, we gave him some tests to perform, and these were the investigating tests. First of all, we did him CBC, that is complete blood count, to check for any infection. Suppose if there is infection, there will be increased level of WBC, right or no? Yes. Next, we also told him to do some like KFT, kidney function test, to see his urea and creatinine level and electrolytes as well, to see how the kidney is working. Like suppose if urea and creatinine levels are high, that means the kidney is not functioning properly, and that might be a sign of infection or some stones or some obstruction in the kidney, right? Next, we also asked our patient to have urine test, and there were two different types. The first one was a detailed report on urine, that is in that test we will be seeing any type of like all the color, appearance, pH, and any type of protein, bacteria, pus cells presence in the urine. And in culture sensitivity, like CS, urine CS, we will be seeing what type of bacteria, if present, what type of it is, so that we can decide the antibiotic, right? Like if pus cells or RBC is present in the kidney, urine test, if we find, that means it will be confirming some urinary infection. Okay, that might be possible due to some stones or severe infection. Next, we also gave him some test, that was X-ray or ultrasonography of the knee, ureter and bladder. These three we asked for X-ray, like imaging. So imaging was done to look for stones or other issues, and what could be the abnormality if present. That was we could find any stone in the urinary tract, or that will be shown in like white color spot, and we can also see some swelling that will be indicating kidney infection, right? So these were the diagnostic tests we performed, and after the test results came, we came to the conclusion that our patient is suffering from UTI. Okay, and that's why you are showing fever with burning micturition. Okay, now as we got to know that our patient is suffering from these things, so we came to treatment part. And before I go to treatment, I will be describing what is pus cells. I miss out that thing. Pus cells means, in simple words, leukocytes. Okay, we all know leukocytes is a part of or type of WBC, not part, type of WBC. And increased pus cells means increased WBC in some particular portion, right? That happens when there is bacterial presence, and that indicates what? That indicates infection, right? So increased pus cells means infection at that site. Got it? Now let's come to the treatment part. Firstly, as it is UTI, that means urinary tract infection, so for infection we need what? Antibiotics, right, to kill the bacteria. So first we can give levofloxacin 250 mg 3 times a day, or 500 mg 2 times a day, or also we can give cefixime capsules 400 mg once daily, right? Let's talk about this medicines first. Levofloxacin, if we talk about, that comes under the fluoroquinolone antibiotic class, and that works like how? That will be working by preventing the DNA replication, okay, and thus killing the bacterial organisms. Next, if we talk about cefixime, that comes under third generation cephalosporin antibiotics, okay. They will be, how they will be working? They will be inhibiting the bacterial synthesis of the cell wall and thus leading to the death of the bacteria, right? Next, as our patient was suffering from pain as well, pain and fever, so we thought to give some antibiotic, that is paracetamol, mostly used for fever and pain, okay. Antibiotic that works by reducing the prostaglandin synthesis, that is the thing that will be stimulating the pain perception. So we'll be reducing that prostaglandin synthesis, thus reducing the pain perception. Or we can also give mefenamic acid 250 mg or 500 mg 3 times or 2 times a day, right? So that is coming under NSAIDs, means non-steroidal anti-inflammatory drugs classification, and they will be working by decreasing or inhibiting the work of cyclooxygenase 1 and 2, and thus reducing the prostaglandin synthesis and reducing the pain perception, right? Next, we are giving syrup sodium acid citrate, okay. That will be coming under the classification of urine alkalizer, okay. What it will be doing? It will be making our urine less acidic and reducing the burning sensation. As I said in the beginning itself, that when we get the burning sensation, it means that we are having bacterial infection, because bacteria makes our urine acidic. So by giving paracetamol or something, we can decrease the pain, but the burning sensation still persists. So to decrease that, we have to alkalize our urine, and so we'll be giving this sodium acid citrate. Got it? Next, if the patient is suffering from vomiting or nausea, we can give domperidone like 10 mg 1 tablet, or we can also give ondansetron 4 mg 1 tablet. Yes or no? Right. I hope we got the medications, and this we discussed for adults, okay. Suppose a aged person. Now if our patient in case is some children or kid, then the treatment regimen or the style will be changed. Why? Because that time we will be deciding the dose very precisely based on their based on their body weight, and so that's why we will be mostly try to give the medicines in syrup dosage form, so that the patient feels to take it, because tablet is also a big hazard for the patients like children's to ingest, right? So for children's, firstly, to kill the bacteria, we will be giving nalixylic acid, or we can give ciprofloxacin, that is also coming under fluoroquinolone, as I said, and cotrimoxazole, that is coming under cotrimoxazole coming under sulfonamide category or classification of antibiotics, and that is a combination of what? Trimethoprim and sulfamethoxazole. We can use this any antibiotic in syrup form for the patient who is a children. Next, for antipyretic, we can use any kind of syrup, like for paracetamol we can use, or brufen like ibuprofen, panadol, we can use these things 1 to 2 tablespoon 2 times or 3 times a day for decreasing the pain and fever, right? Next, for burning micturition, again we have to make our urine alkalize, and so we can give Cranmax aqua or syrup Canova. These things we can give 1 to 2 tablespoon, and BD or OD once or twice a day. Next, again, if our patient is having nausea and vomiting, we can give Gravinate syrup, okay, not ondansetron or domperidone directly. We can give Gravinate syrup 1 to 2 tablespoon BD or TDS. So this was a very simple explanation on fever with burning micturition that mostly indicates UTI. So these were the tests. We'll be mainly seeing kidney, and we'll be seeing our CBC, and we'll be seeing some urine test. By doing these things, we can get to know or get confirmed that if our patient is surely having UTI or not. If yes, we can treat him with these medicines. I hope you got to learn something new in this video, and if yes, please put a like, hit the like button, hit the subscribe button. That motivates me to make these videos, and I hope you are liking my videos. Please subscribe so that I can go far along with you guys. Okay, thank you so much for watching. We'll be meeting in another one.